junior doctors across England began a 4-day strike over pay as UK's National Health Service, or the NHS, braces for the most disruptive walkout. Tens of thousands of junior doctors, qualified physicians who make up nearly half of the medical workforce, are striking for pay rises that are better aligned with inflation. Meanwhile, more than 250,000 appointments and operations are expected to be cancelled, with some hospitals reporting that almost half of all the planned treatments are likely to get disrupted. According to the NHS estimates, between 250,000 and 350,000 appointments and operations are likely to be cancelled. However, the union said doctors will report back to duty if lives are in immediate danger.
The morale is at an all-time low. I don't remember the last time I went home and felt like I've done a wonderful job, everyone's got the care they wanted, the care they deserved. I don't remember a time I've gone off shift and felt like I had energy for anything left. We're just all running on empty, emotionally, physically. It's a dire situation.
The junior doctors' approach is diametrically opposite to recent strikes by nurses and doctors, as they exempted certain emergency services. Health Secretary Steve Barclay accused unions of timing the strike just after Easter weekend, as many hospitals are expected to see a surge in demand.
Well, I deeply regret these strikes, and in particular the timing, which have been timed deliberately coming straight after Easter. The fact that the PMA junior doctors have asked their members not to tell NHS managers whether they intended to go on strike or not, making contingency planning more difficult, and also their refusal to agree any national exemptions.
Last month, a 72-hour strike by junior doctors led to more than 175,000 patient appointments and procedures being cancelled in England alone. Junior doctors represent nearly half of the medical workforce in England. For more on this, our correspondent Alex Izad from London sends us this report. Listen in.
As junior doctors go on their 4-day strike, Health Secretary Steve Barclay has said that he still believes that they are militant and says their demands are unreasonable. Speaking earlier today, he said he would not come to the table with the unions behind the junior doctors until they call off the strikes. Now, that's the British Medical Association, and they're asking for a 35% pay restoration, they're calling it, not just in line with inflation, but for the past decade, when they feel that the cost of junior doctors has gone down. And they also want to get that pay rise with no additional problems, and they want to make sure that they can work their best and give the patients as much as possible. Now, the NHS has said earlier today that they are worried that patients will be at risk, specifically during this 4 days, as it's just come after the bank holiday weekend when some staff were on holiday. Now, going forward, they have got contingency plans in to make sure that patients are looked after, but a lot of cancellations have happened with operations and appointments as well, which will add to that huge backlog that we've been seeing over the past few years. Ultimately, though, junior doctors and NHS staff do have the people's support, with the Ipsos survey suggesting that a lot of the UK are behind them, and they want to see a resolution, and they want the government to come to the table and look forward to working together, see how much they can give them an extra pay rise. But at the moment, the government isn't planning to do that at all. So it looks like the next couple of days we're going to see the junior doctors continue to be on the picket lines. This is Alex Izad reporting from London for WION. World is One.